Hi, I'm here with Dr. Alan Moses. We're in the Sears Tower. Alan just gave a course to several dentists from all over the world on the Moses appliance for treating sleep apnea. Dr. Moses, thank you so much for being with us.
My pleasure.
Now, you're a dentist. You practice in the Sears Tower, and you have a special interest in sleep apnea and snoring.
Yes, that's right.
Okay, so how is that being in the Sears Tower doing dentistry? That's quite unique.
It's very unique. It's a pleasure to come here. It's a humming, hustling, busy building.
Yeah.
And there's lots of people working in this building and one dental office, so it's really very, very nice.
Well, great. So now, how did you get an interest in sleep apnea and snoring treatment?
Well, I was doing TMD for many years.
Okay.
And then a friend of mine told me that there's a lot of contentious disagreement in temporomandibular disorders.
Sure.
And so I had left the University of Illinois and my relationship with them. A friend of mine said that he was leaving his position at Rush Medical School in sleep disorders.
Okay.
And I thought, well, I'll go over there because there's a link, like there's a bond between temporomandibular disorders and sleep.
Okay.
We're dealing with the same muscles, the same structures, and it's important to know jaw problems before you're treating sleep problems. So I was happy to go over there. I went over there, interviewed. They liked me, I liked them, so I started teaching there. And I've been there now since 2001. It's been a long time. It's a lovely relationship. Sleep at Rush is in the Department of Psychology.
Okay.
At some point, a little bit later, I was asked to give a guest lecture at Northwestern, which is also just up the street in the opposite direction from Sears Tower.
Right.
And so we came to a relationship too. And I'm on faculty there as a consultant.
Okay.
And at Northwestern, sleep is in neurology. So I get the lectures from the neurologist, and I get the lecture from the psychologist, and I get a very interesting perspective. It's easy to be interested with that kind of stimulation.
Well, wonderful. Well, okay, so what about sleep apnea and snoring? And as far as the patients go, how prevalent is this, and what's the need for treatment? Is it really a problem?
It is a problem. We're finally confronting dentists with a life-threatening situation. Apnea is very serious. There's a lot of comorbid consequences, and it's important to treat it. If the patient doesn't treat it, as my friend Richard Renato says, it's choking, gasping, dying of sleep syndrome.
Right.
And so we want to treat.
And it's true.
It is true. And so we want to treat these patients. More importantly, we want to prevent and intercept the problem when there's children. That's another aspect. So we have a womb-to-tomb role here in intercepting these problems. And at that point, when they're children, it's developing the faces. It's very important work.
Right, and dentists are key people to do that because we see these people routinely. We already do the examinations that are appropriate for this, or just a little more added to our current examinations, and we're wonderful to be able to see this and refer to the correct physicians.
Dentists do oral appliances. We're experts at making oral prostheses. We're experts at oral function, and the oral appliance for the treatment of sleep apnea and snoring is far more popular, far more comfortable than CPAP, which is essentially putting a pump on your face and mouth and pumping the air to break up the occlusion. It's a pneumatic splint. We have somewhat of an anatomic splint. And so we make the airway larger as well, but it's very comfortable.
Right.
And it's
portable.
not portable, non-invasive. So it's a very important service. That's for adults. For children, we're capable of preventing the problem by developing the faces with interceptive orthodontics and diagnosis. Recognize the problem and it's treatable.
Recognize the adenoids, tonsils, the allergies, expand the palate, that type of thing.
Exactly.
Right, which you talked about in your course.
Get the kid to sleep with their mouth closed and you get a beautiful face.
Right, tongue position, mouth closed, breathe through the nose, everything develops much better.
You got a good grade in that course, didn't you?
Absolutely, I listened. So now you developed the Moses appliance.
Yes.
And basically we're talking about getting oxygen to the tissues of the body through proper breathing and open airway, so that the tissues can rest, so that the tissues are healthier, people aren't sleepy during the day, and they function much better.
Yes.
So you developed the Moses appliance recently, and oral appliances just came really into the forefront in about 2006 or 2007 when the laws changed and the recommendations of the American Academy of Sleep Medicine changed to include oral appliances, and then Medicare covered them. So this is relatively new.
It is relatively new.
And then you developed the Moses appliance for this, which I love, and in fact have one of myself, although I don't have sleep apnea, but still it improves my breathing even though I don't have sleep apnea. And I can sure tell a difference. I'd snore a little and don't snore at all with the Moses.
Well, I started out years ago. They said to me at Rush, they said, how are you going to prove that oral appliances work?
Right.
And so I said, well, we'll have to get a device. I bought a device, took it home as any dentist would do, test it on yourself, and I had apnea.
Okay.
So I thought, well, maybe there's a mistake here. I went and slept in the sleep center, and they confirmed that I had apnea. It was serious. It was advanced. It was severe. So I was surprised. I mean, apnea, yes, I'm a little overweight, but I didn't think I snored. I wasn't sleepy. I felt terrific.
Yeah.
So all of a sudden I had it, and I went, and, as I say, we tested at the sleep lab, and so now I have to solve the problem. I went and I tested, I prescribed and tested 6 different appliances.
Okay, there are
that were
many
out there. There are many out there. There's actually about 95 approved by the Food and Drug Administration for the treatment of oral appliances, for treatment of apnea and snoring. And I didn't find one that worked. And so I had to think this problem through.
And you're very academic and very research oriented, so when he thinks something through, it gets thought through really well.
Well, it's a basic concept. I wanted to get more room for the tongue, and I wanted to get the tongue in as forward a position as I can, because the more forward and the more room, the less likely it is to collapse.
Right.
So the big innovation, open anterior. You can get the tongue clear through to the lips.
Right.
And so it's nice to have been able to find something that innovative that easily. But I had the need. It was a very imperative thing. So now I can practice sleep dentistry, and I have the devices working the best for many people, and it's comfortable. You can talk with it, you can drink with it, and it's comfortable, and you breathe better with it.
Right.
So these are all good characteristics, and it's strong, it's adjustable, and it's made beautifully.
Yeah.
And so
quality workmanship in the
fabrication. So it's a joy to do this. And the other thing that's nice is that dentists are finally getting into this. So we teach courses.
Right.
And it's nice because it's very gratifying. The people who were at this meeting, they were attentive. Right. I mean, there's very few people sleeping. This is good stuff. It's fun. It's fun to teach an appreciative audience. And the questions are great. It's stimulating. It's exciting to do something new. The people were excited about what they're learning. It's exciting stuff.
This is an international audience. We had several people from the United States. We had someone from Mexico, from Holland, from the Netherlands. We had people from Norway, Canada, all over come into this course, and it was fantastic. So with sleep apnea, really, with an oral appliance, you're doing a few things. You want to open the airway. You can do that by moving the jaw forward, by opening the jaw some, and by moving that tongue forward, which is really the key to get that tongue out, because that's what collapses back in the airway, especially in supine position during sleep.
And there are protrusive tongue reflexes that we can stimulate by training. So we have exercises we can prescribe as well.
Right. Okay.
Well, we have Dr. Bonato here, and it was very adventurous to teach a course where day one we get a baseline.
Right.
The appliances were ordered by these doctors 3 to 4 weeks before the course. When the enrollment closes 3 to 4 weeks ahead of time, the appliances are waiting for them at the course.
Right.
So day one we took baseline, taught them how to insert the appliance, taught them how to adjust the appliance. They slept with their own appliances, and we tested them the very next day.
And the results were wonderful.
Results were amazing.
Everybody improved. It was incredible.
We get incredible results, but it's really a big gamble because if everybody got bad results, it wouldn't look so good. And we serve a little wine with dinner both nights,
Yeah,
and so
it's
it's a challenging test, but we have something. We have the right equipment to measure, and we have the right device to work with, and so we get the results, and it's a joy.
What do you see in your practice? This is a wonderful service for patients. What kind of comments, what kind of results do you get, and then comments from the patients and the patient's bed partners? Tell us a little bit about what you experience by treating sleep apnea in your practice.
It's very gratifying because the patients will say, "Thank you for giving me my life back," or "Thank you for getting me back in bed," because there's a lot of people out there who are sleeping in separate beds and in separate rooms, and this snoring is a huge problem that breaks up marriages, breaks up relationships, and so we are able to get people sleeping in the same bed, comfortable. We cut the snoring, we cut the apnea. They sleep better, they feel better, they look better, and they live better. This is really very important quality of life issues. Breathing is important.
Yeah, well, and as Dr. Bonato says, you can live a few weeks without food, you can live a few days without water, I believe it is, but only a few minutes without oxygen. So oxygen is key to life.
Air.
Absolutely, air. So, okay, so what about the financial aspect for the doctor? Is this just a gift that they're giving away, or is it financially viable for the doctor in their practice?
No, it's financially viable. The important thing here is,
the answer to that.
It's not, I know, but it's not that we're selling widgets. I don't sell Moses Appliance. It's a service. It's a very important service. It's making sure that whatever we do works, and sometimes we have to do more than just stick an appliance in the mouth to get it to work. We have to get them healthier. And so it involves lifestyle changes sometimes, it involves exercise, it involves training, mouth exercises, oral exercises. Yes, it involves the appliance. It involves analysis of the nose. It involves analysis of the environment. Are they allergic to the dog? Are they allergic to the feather pillow?
Right.
So it's a very important service that we provide, and it's a very wide-ranging service. And so it's very gratifying.
And multidisciplinary. You involve other physicians.
Absolutely,
as well.
Absolutely.
Yeah. Well, how do we get in touch with you, Dr. Moses? You give seminars, you've made the appliance, you teach us how to help our patients. How do we get in touch with you?
You call.
Okay.
You call, my office is 312-993-0430, www.themoses.com.
Okay.
We have websites. www.kidsapnea.com is a very informative website. So.
Well, Dr. Moses, thank you so much for being with us and
Thank
for
you,
all
Mike.
you've done for our patients and the profession.
It's a pleasure meeting you and talking with you. Thank you.